If you're over 60 and your hips feel stiff the moment you get out of a chair, if your lower back complains every time you bend down to tie your shoes, or if walking has slowly turned from something effortless into something you have to think about with every single step, stay with me for the next 25 minutes or so, because I'm going to walk you through one specific exercise, just one, that I genuinely believe does more for pain and mobility after 60 than almost anything else I recommend in my entire practice. And by the end of this video, you're going to know exactly how to do it, exactly why it works, and exactly how to start tonight without any equipment, any gym membership, or any pain to get there. And frankly, without spending a single dollar on anything at all. I'm Dr. Hale Thorne, and I've spent more than 30 years practicing medicine, a huge portion of that time spent specifically helping patients in their 60s, 70s, and 80s move through life with less pain and more confidence in their own bodies. And I'll be honest with you, my own hips and lower back aren't exactly what they were 30 years ago either. So when I tell you about this exercise today, I'm not speaking purely as your doctor. I'm speaking as someone who genuinely does this same movement himself most mornings right before that first cup of coffee, because I noticed firsthand exactly what it did for my own stiffness before I ever started recommending it to a single patient. And frankly, I was somewhat surprised myself by how much of a difference one simple movement could make. Before we get into the exercise itself, I want to ask you something. Down in the comments, tell me your age, and tell me specifically where you feel the most stiffness or pain right now. Hips, lower back, knees, wherever it is for you. I read every single comment that comes in on these videos, and it genuinely shapes what I cover going forward. So don't hold back. There's a good chance someone reading those comments is dealing with exactly the same thing you are. Let me tell you what this exercise is, because I want to get straight to it rather than keeping you waiting. It's called the standing hip hinge, sometimes also referred to as a modified deadlift pattern. And despite that slightly technical sounding name, it's genuinely one of the simplest movements in all of physical therapy. You stand with your feet roughly hip width apart, soft bend in the knees, not locked, not deeply bent, just soft. Then, keeping your back in a long neutral line, not rounded, not arched, you hinge forward from your hips, the way you'd lean forward to close a low dresser drawer, letting your hips push back behind you as your torso tips forward until you feel a stretch along the back of your legs. Then you reverse the movement, squeezing through your hips and glutes to stand back up tall. That's it. No weights required, though. We'll talk about adding light weight later for those who are ready. No gym. No special equipment beyond your own body, and maybe a sturdy chair nearby for balance the first few times you try it. Now let me explain why this particular movement matters so much more than people realize, because the reasoning behind it is genuinely fascinating once you understand it. So much of the pain and stiffness that creeps in after 60 isn't actually coming from where people think it's coming from. Someone feels lower back pain and assumes their back is simply wearing out, the discs deteriorating, the spine simply giving up after decades of use. When in a remarkable number of cases, the real issue is that the hips have become so stiff and so weak that the lower back is being forced to do work it was never designed to do, compensating for a joint above it that stopped pulling its own weight, quite literally. Your hips are supposed to be the primary engine for bending, lifting, and changing direction in your body, the largest, most powerful joints you have, built specifically for exactly this kind of work. When that engine weakens and stiffens, which happens gradually to almost everyone who spends years sitting more than moving, sitting at a desk for decades, sitting in a car, sitting in front of a television in the evening, the spine starts absorbing forces it was never built to absorb on a daily basis and over months and years. That's exactly the kind of repeated strain that turns into the chronic lower back pain so many people simply accept as an unavoidable part of aging, when in reality, it's frequently a downstream consequence of something happening one joint higher up that nobody ever thought to address directly. The hip hinge directly retrains and strengthens exactly that pattern, teaching your hips to do the work they were designed to do, restoring both the strength and the flexibility in that joint simultaneously, in a way that very few other simple movements manage to accomplish at the same time. It's not just stretching, and it's not just strengthening. It's genuinely both happening together, with every single repetition, which is exactly why I consider it so much more valuable than either a stretching routine alone or a strengthening routine alone. The kind of efficiency that matters enormously when you're trying to build a sustainable habit, rather than an elaborate routine nobody actually has time for. Let me tell you about a patient of mine, a woman named Marjorie, 81 years old. a retired librarian who'd spent 4 decades on her feet helping people find exactly the right book, who came to me describing exactly the situation in that title, lower back pain that had quietly worsened over about 3 years, to the point where she'd stopped taking her usual morning walk around her neighborhood, something she'd done religiously for over 20 years before that, rain or shine, often the first to wave hello to every neighbor out watering their garden along the way. She told me, almost apologetically, that she'd simply assumed this was what 80 was supposed to feel like, that her mother had walked with a stoop by this age too, and she figured it was somehow inherited, unavoidable, just her turn, the family legacy nobody gets to opt out of. When I evaluated her, her hip mobility was significantly limited, far more than her back itself actually showed on imaging, and her glute strength, the muscles in her hips and backside, tested remarkably weak for someone who'd otherwise seemed quite capable and independent in every other way, still managing her own household, still driving herself everywhere, still sharp as anyone half her age in conversation. We started her on the hip hinge, just the body weight version at first, 10 repetitions, twice a day, nothing more complicated than that. Something she could do right there in her own kitchen while waiting for her morning coffee to brew. Within about 3 weeks, she told me the morning stiffness that used to take her nearly 20 minutes to work through had shortened considerably, down to maybe 5 or 6 minutes most days. By 2 months, she'd started walking again, first just to the end of her block and back, then gradually further, until by month 4, she'd returned to her full neighborhood loop, the same one she'd given up entirely 3 years earlier, waving to those same neighbors again as though no time had passed at all. She told me with tears genuinely forming in her eyes at that appointment that she'd quietly mourned that walk for years, assuming it was simply gone for good. A part of her life she'd have to accept losing the way you accept losing anything to age, and getting it back felt like getting a piece of herself back too. Not just her legs, but something closer to her own identity. Now, a quick pause here because if you've made it this far in the video, you're clearly someone who takes their own mobility seriously, and that already puts you ahead of a lot of people who'd rather just push through stiffness silently and assume nothing can really be done about it. Go ahead and tap that like button if this is resonating with you so far. It genuinely helps this information reach more people our age dealing with exactly this kind of stiffness and pain. And let me know in the comments, when you read that hip hinge description, did anything click for you? Any moment where you recognized exactly that kind of compensating pattern in your own body? Maybe a habit you've fallen into without ever quite naming it until just now? I read every single comment, every time. Let me walk you through exactly how to do this safely, step by step, because form matters enormously here, and rushing through it incorrectly is genuinely the difference between this helping you and this potentially aggravating something. Start standing, feet hip-width apart, a soft bend in your knees. Place your hands on your hips or let them hang naturally in front of you, whatever feels more stable for you starting out. And if balance feels uncertain at all, standing near a sturdy chair or countertop you can lightly rest your fingertips on for the first week or two is perfectly reasonable. There's no rush to do this without any support at all. Take a breath in, and as you exhale, hinge forward from your hip joints specifically, not your waist, not your lower back, the hip joints themselves, the same way a hinge on a door swings. Imagining your torso and your legs as two straight boards connected by that hinge point at your hips. Let your hips slide backward as your chest tips forward, keeping that long neutral line through your spine the entire time, never letting your lower back round forward like you're trying to touch your toes, which is one of the most common mistakes I see, even among patients who've watched instructional videos beforehand. Go only as far as feels comfortable. For many people starting out, that might only be a slight forward lean, maybe 20 or 30 degrees. And that's perfectly fine. There's no prize for going deeper than your body is currently ready for, and pushing too far too soon is exactly how people convince themselves an exercise isn't right for them, when really it simply needed to be scaled back to where they currently are. Then, on your inhale, squeeze your glutes and drive your hips forward to return to standing, feeling those muscles in the back of your hips do the actual work of bringing you back upright, rather than your lower back muscles straining to pull you up, which is precisely the shift in effort we're trying to retrain here. I recommend starting with 8 to 10 repetitions, once or twice a day, and paying close attention to how your body responds over the first week. A little muscle soreness in the back of your legs and your glutes, especially the first few days, is completely normal and actually a good sign that you're working muscles that have been underused for quite some time, sometimes years, sometimes longer, depending on how active you've managed to stay. Sharp pain in your lower back during the movement itself is not normal, and if that happens, that's a clear signal to reduce how far you're hinging forward or to pause and discuss the movement with your own doctor or a physical therapist before continuing. Since pushing through genuine pain is never the goal here, the goal is consistent, comfortable practice that builds gradually over weeks. Once the basic bodyweight version starts feeling genuinely easy, and for most of my patients that happens somewhere between 3 and 6 weeks of consistent practice, there are simple ways to progress it. Holding a light object, a small dumbbell if you have one, or honestly something as simple as 2 filled water bottles, one in each hand, adds just enough resistance to keep building strength without needing any special equipment at all. Some of my patients have used a couple of canned goods from their own pantry, which works just as well as anything you'd buy specifically for this purpose. And frankly, there's something satisfying about building real strength with nothing more than what was already sitting in the kitchen cupboard the whole time. I also want to mention something about why I specifically chose this exercise to talk about today, out of everything else I could have covered. There are plenty of exercises that help with mobility and pain after 60, stretches, balance work, strength training of various kinds, and all of them have their place, but very few address both strength and flexibility simultaneously in a movement pattern that translates so directly into real daily activities, picking something up off the floor, getting in and out of a low chair, reaching down to tie a shoe, lifting a grandchild up onto your lap, loading groceries into the trunk of a car after a Saturday morning at the store. This isn't an exercise you do in isolation and hope it somehow helps everything else. It's quite literally retraining the exact movement pattern your body uses dozens of times every single day without you ever consciously thinking about it, which is exactly why the carryover into daily life tends to be so much more immediate and noticeable than with exercises that feel more abstract or disconnected from anything you'd actually do outside a gym setting. I think about how many of my patients spend years quietly avoiding certain movements without ever realizing that's what they're doing. Asking a spouse to pick something up off the floor, choosing the higher kitchen shelf for everyday items specifically to avoid bending down to a lower one, sitting in the front pew at church because standing up from a lower seat feels harder than it used to, parking as close as possible to the entrance of every store specifically to minimize how much walking and bending the whole outing requires. None of these avoidances feel like decline in the moment. They simply feel like small, reasonable accommodations, the same way so many small, reasonable decisions quietly add up over years into a much smaller, more limited version of daily life than anyone ever consciously chose. A slow narrowing of what feels possible that happens so gradually, nobody notices the cumulative effect until they stop and actually look back at how different their daily life has become compared to a decade earlier. I want to address something important before we go further. If you have an existing hip replacement, a significant back injury, or any condition your doctor has specifically told you to be cautious with regarding bending or hip movement, please talk to your doctor or a physical therapist before starting this exercise, since everyone's specific situation is different, and what's safe and beneficial for the majority of people watching this video may need modification for your particular history, your particular surgical history, or your particular combination of joint conditions. This isn't meant to replace guidance specific to your own body. It's meant to give you a starting point for that conversation if this is new information for you, something concrete to bring up, rather than simply guessing on your own about whether something like this is appropriate. I also want to be honest about timelines here because I don't want to oversell this. Marjorie's results over 4 months are genuinely encouraging, and I've seen similar transformations in plenty of patients since, but everyone's body responds at its own pace, depending on how long stiffness and weakness have been building, sometimes years, sometimes decades, what other health factors are at play, and how consistently the exercise actually gets done, which honestly is the single biggest factor in whether anyone sees real results from anything we recommend in medicine, far more than any small variation in technique or form. The patients who do best with this aren't necessarily the ones who do it perfectly from day one. They're the ones who simply keep showing up to it, day after day, even on the days it feels unremarkable, even on the days nothing seems to be changing yet, trusting the process the same way Marjorie had to trust it for the first few weeks before she noticed anything different at all. So here's what I want you to take away from today. Tonight, or first thing tomorrow morning, try 10 slow, careful repetitions of the standing hip hinge, paying close attention to keeping that long neutral spine and letting your hips do the actual work. Do it again tomorrow, and the day after that. Give it a genuine 3 to 4 weeks of consistency before deciding whether it's making a difference, because real change in how a body moves rarely happens in days. It happens in weeks, through repetition. The same patient repetition that rebuilt Marjorie's ability to walk her entire neighborhood loop again after 3 years of believing that part of her life was simply gone for good. A belief that turned out, thankfully, not to be true at all. Before you go, think of someone in your life who's mentioned feeling stiffer, slower, more cautious about bending and lifting than they used to be, a spouse, a sibling, a close friend, and send them this video. Sometimes the most valuable thing we can offer someone we love is simply a starting point they didn't know existed, something concrete to actually try instead of just accepting stiffness as the new normal, the kind of quiet resignation that so many people settle into simply because nobody ever offered them a real alternative. And if you want to know the second movement, I almost always pair with this one, the one that addresses the other half of what so often goes wrong with hips and lower backs after 60. That's exactly what I'm covering in the next video, so don't miss it. This video is intended for general educational information based on clinical experience and published research, and it is not a substitute for an actual conversation with your own doctor or a physical therapist who can properly evaluate your specific situation far better than I ever could from all the way over here. Take good care of yourselves, and I will see you in the next one.